So as I get ready to ask my questions, I would like to invite the audience to get ready by the mics to ask your own questions. So I am a firm believer that public health is mostly about relationships over programmatic aspects of our work. And I would love to hear a story of relationships that either advanced or threatened to get in the way in some of the wins that you were able to advance. So would you like to start?
I love this question because, especially in a rural community, relationships are everything in public health because we have no money. And so we have to rely on working with our partners to either give us money, give us time, give us a letter of support, whatever that may be. And actually, I would say we're very fortunate in Klamath Falls that we have really good relationships built, and that's evolved over time. But a really great example and something I'm excited about right now is we, as with everybody, there's a housing crisis going on. And not only is there a lack of housing, but a lack of safe and clean housing. And bed bugs is a really big issue. And everybody calls public health and says, what are you going to do about this? And we say, we have no authority. And code enforcement has no authority. The landlords are pointing the fingers at the tenants are pointing the fingers at the landlords. It's just this really big unsolved problem. So that's one issue, and then the issue of lack of housing in general. And we're trying to, again, redevelop our community, bring in business, bring in industry, whatever that may look like. Well, these people need places to live. And so we're just in the beginning stages of, we've got a housing task force. And I can't remember who it was in the room had said something about, maybe it was you, about how the medical industry should not be building houses. That's not their expertise. And all of us, we recognize the same thing. Public health doesn't want to be a landlord. The hospital doesn't want to be a landlord, but the housing authority does. And so we came together, and so our economic development folks and our Chamber of Commerce and those people, they've all gotten to the table. And so we have this task force that has two arms. One is about how do we get these investors to come? We need them to build the places. How are we going to help them market it? All that kind of stuff. And then another group of us, so the CCO, public health, and the housing authority got together and said, well, our expertise is in programming and lawmaking. And so we, right now, are working on a proposal to basically create a new ordinance that will put accountability on who does what when there's a bed bug problem. And this has multiple ways that you could implement it. So we're working on that. We're working on getting the money to get the heating units that take care of the bed bugs. We're working on an MOU to say who's going to house and operate those heating units, and who is then going to work with the tenants to teach them about here's how to get rid of the bed bugs because you have to do things beyond this heating system, and here's how you prevent them later, and here's how to be a good tenant and create relationships with your landlords. So it's this really beautiful coming together of these non-traditional partners, building these relationships because we trust each other to do what we are best at. And so we don't have a conclusion yet, we don't have answers yet, but that I think is a shining example of how our relationships are taking the work forward.
Thank you.
Sure, if I can borrow that and go back to a visual. So our relationships were really the strength of our coalition. And so I would just show a story of, let's say, the YMCA. The YMCA has strong relationships with different legislative champions than the advocates on the left would. And so the YMCA had their lobby day, and they asked me to come speak and educate their members on T21. So that was one talking point for the YMCA's lobby day. They were able to have access to legislators that, say, the ones on the left didn't have access to during that point in session. So the relationships, it was all about having those relationships, again, as the diverse messengers for the same policy issue. But I would really point to our Board of Visitors who actually really showed up, and I mentioned them here as our last group. That's the last bullet point, and I don't know if you want to speak to this as well, but our Board of Visitors are people of influence who have access in different ways than you and I might have. But they, again, serve on a volunteer voluntary board for us, but again, their whole desire is to see a free world of reducing cancer, or making cancer history, should I say our tagline correctly. And so with that passion and with that cause, they joined us in the effort to raise the age so that their kids wouldn't begin a lifelong addiction to nicotine and tobacco. And so their message as a messenger was very powerful. And those were total relationships where they could host a dinner for a state elected official that I would never have access to, just for an example. But they were our relationships that were key, again, just as a different voice in a different setting in a different way.
I'll highlight, I think the Board of Visitors were exceptionally impactful and important in affecting this policy in particular. The other relationship that I want to highlight is that has been forged across UT system. I don't know if anyone else in the room is part of a large health system. I can think of things like University of California or perhaps the New York systems. But we had 14 entities that largely didn't know one another, and at various times would view one another as competitors as opposed to teammates. And I think, at least in the health-related sector, that changed under the leadership of David Lakey, who was a former state health commissioner who moved into UT system at a leadership level as something a vice chancellor, perhaps. I don't have the title correct. But what I do know is he stimulated understanding. He convened the health and people that are interested in population health on at least something like a quarterly basis for a couple of years, had us working together to develop population health plans for each of our individual campuses, and then the second year brought those together to try to find commonalities. And what's resulted is a very nice blueprint. It's a very high-level blueprint, but it's been extremely important in building relationships across our campuses. I think we're much more capable of understanding one another and relating to one another and working together to affect meaningful change. And heaven knows, in a state like Texas, we have a lot of changes needed.
Thank you so much. Thank you. So, ladies first, I will ask that you introduce yourself and state your affiliation, please.
Sure. Alyssa Crawford from Mathematica. Yes. Can you hear me now? Yes. Okay. Alyssa Crawford from Mathematica. Building on that conversation, because when I think of public health, I think of relationships, but then I also think of gathering and translating evidence in really impactful ways. And for all of what's been discussed, there was a certain undercurrent, I heard at least, of having to both gather and share information about the evidence behind the issues that you're trying to address and helping to convince, whether they be your coalition members or the policymakers that you're trying to actually impact, trying to really convince them of the need to take action and what particular action should be taken. But one of the challenges that I think a lot of us have seen is the research that's being done, the way that research is conveyed is not always usable for those kinds of conversations. So I was hoping you could speak a little bit to some of the gaps you're seeing in either the kinds of research that's being done or the ways that research is being communicated and ways that evidence could be better provided for these kinds of really important activities.
Sure. So I'll speak specifically to T21. The evidence existed from the 2015 IOM report on raising the legal age to sell tobacco. So when that report came out, we knew elected officials don't read 25-page reports, so we made a one-page infographic, and that's the way the evidence translated to real life in 4 boxes of the highlights and what it would mean for Texas. And we specifically put the toll of tobacco in Texas as supplemental second half of our infographic. So we just took the highlights from that report and then made it into one-page evidences for our elected officials and decision makers, and that was our talking points. Pretty much everyone in the coalition appreciated that one-pager. Some of them even made it their own and put their own logos on it, and so that was another way relationships. It was okay, steal our logo, steal our fact sheets, just get the word out. But ultimately, that's the way that we translated evidence into real life and could drive that home with a decision maker or policy maker, because then you could translate that into their county or their public health region or their district in which they represent, because we had UT Austin have some research into tobacco's effect on their public health district or even their legislative district. And so we would supplement depending on the decision maker. If they were receptive to that kind of data, we could parallel it with tobacco's impact in their community. So I hope that helps answer as an example.
I'll add a bit to that. When the institution 5 years ago or so made a stronger commitment to prevention and further defined what we were talking about in our 4 domains, our 4 mission areas, and we're talking really about cancer control, we began by compiling a database, essentially drawing from other resources. Again, we're interested in our own researchers' actions, but really once they've been put into place and vetted through the kind of traditional peer review process. So we relied upon existing things like the community guide, WHO, best practices, and we compiled that. It rarely matches the specific application that and population that we're attempting to put it into, but nevertheless, it serves as a very important foundation and a very distinctive foundation. So that's one thing we did. Second, we hired a staff that's devoted to these kinds of actions, because our faculty are great at conducting research, answering important questions, but they're not experts really in implementing many of these things. They're experts in implementation science, but not necessarily implementation. And so we found that there's a critical component that's distinctive from a usual academic faculty, and Jennifer is one of the examples that leads the tobacco program. So it's having an evidence base and then having effectors that actually are experienced and capable of putting those programs in place with all the attendant tailoring, et cetera. The other thing I want to say is when we're working in a policy domain, what we've learned, and probably most people in the room have learned as well, it's important to have the evidence, because you never want to advocate for something that's not evidence-based. However, it's equally important to have a story. So just as you highlighted the importance of stories to population health, I would say they're critical for convincing legislators of the need for action.
Data is an incredibly important piece of our work, and I would say working in a rural community, that's one of our biggest struggles, because we don't have an epidemiologist in the entire county. And we really do rely on our academic, we've got one university there, it's small, but they have a few of the professors who are community oriented and who are willing to partner with us to help us gather and analyze and then display data for us. And so that's something that we're still working on. One nice thing is with the Blue Zones project, Gallup comes in and they do an oversample for us. And it focuses on the different domains of the Blue Zones project. So that's getting us to where we need to be. But we're not there. And I don't have an answer, but I have a couple of struggles that I'll just I'll let you know about, because we try to get information from the hospital system, and they're willing to work with us, but Epic is their electronic health record system, and it's like a black hole of information. You can put tons and tons in. It's very hard to get it back out in a coherent way. And our hospital and our FQHC and the CCO all use different electronic health record systems. So we're not getting apples to apples data. That's really hard. And then finally, because we are so small, a lot of times we get state level data that's not applicable. Yeah. And so we're trying, and we do the best that we can. And finally, I would simply say the data piece, what's difficult is when working with our legislators, if you've never worked at local public health before, they don't understand that change takes a lot of time. And so they said, well, we saw this data, you advocated for this money, we gave it to you. I'm not seeing a change a year later. And we said, well, the data, the lag time just in general is years, as we all know. And so trying to make our legislators understand that you're not going to see a change in the data unless it's referrals in 2 or 3 years.
Thank you. All right, Mike.
Thanks, Mark Arevich, NYU, and the roundtable. So my question, it's really a common question. It's very impressive to see a health system engage in this kind of legislative advocacy and with partners make change at the state level on something that's so important to public health. So it really is an example of kind of upstream action in that sense. Tobacco is certainly etched in all of our minds as pound for pound one of the greatest causes of illness and of cancer. And the evidence base for it is probably better than for most other things. Are you thinking of applying this model of sort of advocacy to other drivers of poor cancer outcomes? I can think of some like physical inactivity or diet that are pretty clear, and then others that are less, that are sort of more in the social or environmental domain.
The answer is yes, because again, our reason for being is to eliminate cancer, and so you've got to pay attention to all of these risk factors, whether it be they social or behavioral or whatever. So the answer is yes. It's very difficult to do, I will say, in the context of a state that's as conservative as ours, and that values personal freedom over any measure of social action. So we pick our battles carefully, and we have a rather large team internally that considers all the various options. And, tobacco, we try to establish comprehensive tobacco-free law in Texas for, I've been there 12 years, almost every 2 years when our legislature meets, we advance that. We gave up on it because there just aren't willing to even entertain it any longer. Tobacco 21 was relatively new. There was a lot of evidence base behind it, and so we felt we could make a compelling case. Even there, it took us 2 sessions. So your vision is exactly right, and that's where we plan to go. How we get there is the biggest challenge, and we have to be rather measured in the way we do it, and we think the coalition idea was really important here. But it's all premised on that evidence base first. So as the evidence grows that these kinds of actions make a difference, we'll be able to move in those directions, I think.
And just to piggyback off that, so the 2 parts of the control platform in which I sit, one is doing place-based initiatives, which are inadvertently addressing diet and physical inactivity in 2 small towns outside of Houston. So that's kind of our model program right now, piloting to see outcomes and getting metrics and evaluation in place to work in a place-based approach comprehensively with partners on the ground, from food insecurity to complete streets to everything you just labeled as public health. That's what we're doing in Baytown and in Pasadena. And so, yes, we're very happy. And we want to challenge other cancer centers to step up and do the same, if I can issue that challenge in my position as a non-faculty member, to just be a part of your community, be part of the change and the solution.
So I would like to say I'm terribly sorry, nothing personal, but we're done for this portion of our day. And I would like to ask all of you to join me in thanking our speakers this afternoon.